Here's me. Oh man, look at, I did it again. I hit the recording button and I didn't turn on the silly little light. You know what? Let's do the usual magic trick. Here we go. Boom. Look at that. It's a little bit of that Chiro magic. You know, one day I'll remember to just make sure everything's working. At least this time I checked the microphone. Last week I think the microphone was off. I think it switched to the webcam for some reason. I don't know. Electronics continue to they continue to just confuse me all the time. So we're just gonna have to go with what we got. So anyway, let's talk about some Reddit. So today we're going to look in our chiropractic, and this one's actually a question way of looking at it, I guess, that comes up pretty frequently, and there's a bit of like the dirty underside, I guess, of chiropractic involved in this, and I thought it would just kind of be, I think it'd be an interesting discussion, because it wouldn't be fair if I just sat here and only talked about the good parts of chiro, even though I do think that a lot of times the bad, like many things in life that are good, there are parts of it that could be seen as negative or bad, and I think if you don't ever drag those things out to at least discuss it openly, then, you know, I don't think it's fair, honestly. Like, you know, if there's an argument that you have to make about the things that you think are good in the world, there's going to be negative parts to it, and if you're not willing to even pull it out to examine it, then I think that you are not fully aware or appreciating of the fact that not everybody thinks exactly like we do or whatever. I don't know if that's like a good way to put it, or if I sound like a silly Billy on that one. I apologize for the language. It's it's something that I think should be discussed, if nothing else. So, you know, instead of burying the lead, let's get to it. So the question is, as a patient, should I have an expectation of an exam or adjustments? That's something that does come up. The personal philosophy of chiros, when it comes to adjusting on the first visit or what we do on the first visit, there is some variety to it. And I personally, and I'll begin this whole discussion by kind of giving my own personal philosophy of it. I have always been of the mind that anything that you go to, and especially if you spend money on it, should be very performance based. And what does that mean? It means to me that if you were to come to me personally, I've always had the personal opinion that the treatment should start pretty soon, if not the first visit, definitely the second visit, where you feel like you're being seen. I feel like that's probably the biggest part of it, is that people don't necessarily feel seen by their doctor in regards to them being like a specific entity that needs attention, and they get cookie cuttered. I think a lot of people do feel that way, and in some ways that's warranted, in some ways it's not. Again, I'll kind of leave that open to your own personal opinions, but I guess I'll state my personal opinions on it. Let me at least read the question, and I guess I could elaborate a little bit further. I just got back from a new chiro hoping for treatment for neck strain, and aside from balance exam from their new patient coordinator, the chiropractor recommended I come back for x-rays and no adjustment. Now, I totally get if he had done an exam and talked me through why it didn't warrant an adjustment today, but he only talked to me, didn't observe me or look at any movements from me. He said he'd need to come up with a treatment plan before he possibly did an adjustment. Is that the typical experience a patient should get? He said at minimum he'd put me on spinal decompression machine, but I declined. Okay, so this is something that I do think is a part of this industry, I guess is probably a good way to put it, where there are a lot of chiros who are doing they come in and they have like other people. I wouldn't say necessarily like doing an exam per se, because that's not exactly what it is, but the new patient coordinator whose entire job is to do the onboarding process of a chiropractic treatment, shall we say. Now, why is that? I don't know. There's going to be a lot of personal preferences and a lot of personal philosophies that pop up when it comes to this kind of topic, and so I'm going to try and be as least aggro as humanly possible. I think some of it might slip through, but I have personal opinions on this kind of treatment style. Being in the position of knowing how the money side of the business works and how the mind frame of patients goes, I can kind of read between the lines on this, and I can see why it is that they might be making the decisions that they're making. And the first question that I think a lot of people would wonder and or think is, do you think it's malicious? And ultimately, my answer would be no. I don't think it's malicious, but I do think it is, in my opinion, and then this is exactly where the personal philosophy part of it goes, I think it's a little disingenuous from the viewpoint of somebody who is in pain. How much pain you're in for a neck strain, you know, it's up to interpretation. There are people who have, you know, like legitimate like back emergencies who might completely view this differently, blah, blah, blah. Especially if it's not particularly dangerous. Is there any harm in waiting? Well, no, not necessarily, but as somebody who is a guy who likes to do things, right, and get things done, the way I see it is if somebody's taking the time to go to your place of business and pay you for an exam or whatever it is they happen to be doing, because it doesn't sound like they did an exam in this case. If you were to go there and just talk to somebody who's trying to onboard you, well, then my personal opinion would be, well, what is the purpose of that onboarding? Especially if you went there, told them what was wrong. Does there necessarily need to be an adjustment on the first visit? No, I don't think so. I do think that there is something to be said about the advantage of taking all the information, kind of putting it through your brain and processing, especially if there's diagnostic imaging, if there is an x-ray involved. Is it always a good idea to adjust somebody without an x-ray? Well, there are certainly some flags and all that might come up that would warrant them looking at an x-ray before they give you like a true adjustment. I do think that there's a discussion to be had about all that. Now, in my personal opinion, if somebody were to come to my office, more than likely after I did an exam, if there was no red flags, would I adjust on the first visit? I think more than likely I would. I'm a adjust on the first visit kind of doctor. Again, with the absence of other things. Now, when we moved to our new location, which, obviously not everybody on the YouTube is fully aware, but when we moved to this new location before I started doing the videos, we had an x-ray machine at the old location, and we have the x-ray machine here, but it's not set up. Long story, you need lead in the walls and blah, blah, blah. We can't take x-rays here anymore. So previously, at the old location, if I had enough time to read the x-ray and just make sure there wasn't anything dangerous for the person who was going through the exam and yada yada, well, then maybe I would still adjust on that first visit. But there are certainly some things out there where you hear about it and the way the pain is presenting and all that, if you say, hey, this is what's wrong, they poke you and find that something this is wrong, whatever it happens to be, they take an x-ray and they say, listen, come back next time, I have another person waiting or whatever, and I'll take a look at this on my lunch break or, tonight after I'm done seeing patients or whatever. I'll take a look at it. If there's nothing wrong there, next time you come in, we'll talk about it, do the old racky cracky, off you go. Is that always going to be the case? No, I don't think so. And I would even warrant that, depending on a lot of, demographical information, like younger people, generally speaking, don't really need x-rays unless there's like the thought that there's probably a fracture. Older people, because that's ultimately when you take an x-ray, one of the major components for it, one of the biggest red flags, in my opinion, is if there's a fracture in the area, because you don't want to push on it because it's going to make it, definitely not going to make it any better, and it's going to hurt like the dickens. Again, pardon my language. But there's other considerations, at least in regards to the biomechanics, which I've talked about in previous episodes, where if you take a picture of somebody's spine, you're not necessarily always looking for, at least from a chiropractor standpoint, you're not always necessarily looking for, ooh, look at that bump there, or, well, let me rephrase that. Ooh, look at that thing growing there. It's not supposed to be there. That needs to be removed or pushed on or blah, blah, blah. A lot of times the x-ray, in my opinion, can tell you a story that tells you what exactly it is that person's been doing for, like, let's just say the past 5 years in regards to like working or it just, body lifestyle type stuff. And now all of a sudden you have a spine that's reacting to that kind of lifestyle or is moving in such a way to avoid an injury that maybe didn't fully heal. There's a lot of things you can tell from that kind of stuff. Now, that's a few of the reasons why I would say, okay, maybe they don't adjust on the first visit. The way that it has been discussed with me, and I don't think it's necessarily wrong, but from a patient's viewpoint, it might be frustrating or it might take them a second to like fully realize it. But I have certainly talked to people who, after thinking about it and going about it in like a logical way, they look at it and they kind of view it beneficially in some ways, where if you were to come to me, I took the exam and I didn't rush into the adjustment and I said, let me, process all this stuff, come back tomorrow or whatever, and then we'll do the adjustment. Initially, I think a lot of people would be kind of frustrated because they came to somebody, said, hey, I'm in pain. Can we do something about it? And they said, no, let me look at this information. I'll see you in like 4 days. That might be kind of frustrating, and I think that's completely warranted. But what can happen is that the person makes a plan. They give you the paperwork for it, in a way where they're like, hey, do these exercises. They give you a little plan, whatever. They really just kind of process it all out. And then they give it to you, and then off you go. There's a lot of people out there that I've talked to that say they actually kind of appreciated it after thinking about it, where they didn't just get rushed into what you could call like maybe a more cookie cutter approach to being adjusted in chiropractic. I've seen that argument go both ways. And I think a lot of things that happen in the industry and why certain people prefer certain docs, I think really depends on that kind of discussion, where you think to yourself, well, this doctor is taking their sweet time, maybe, and a lot of times what the chiro is trying to do is they're trying to get you to look at it from a bigger macro standpoint or viewpoint, where you think to yourself, okay, I'm not necessarily coming here just for the pain, because a lot of times when people go to chiros, the first thing that's on their mind is the fact that they're in pain. Is there anything wrong with that? As I have said numerous occasions before this, no. There's nothing wrong with going to a chiro for pain. But so much of chiropractic is based on the idea that you are trying to become more than maybe you originally were. You're trying to improve your performance. You're trying to improve different, qualitative segments of your life to try and, improve life in a variety of ways that doesn't necessarily only include pain. Why is it that they might be doing that? Well, if they go through the exam and all that, and at the end of the exam, which in this case they didn't do an exam, but let's just say that they did, a full-blown exam on the first visit, they did the x-rays, blah, 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 they'll sit you down and be like, hey, listen, you're coming in for this neck pain. Based on what I saw, this might be what's going on. Your neck probably hurts because whatever it happens to be, disc, muscle strain, subluxation, concussion, whatever. Hey, I'm back. You probably look a lot different. I had to come back. As soon as I started talking about that in the last recording, I just got really busy. I wasn't able to get back to it. So here I am again. A little bit less formal, but here we are. Anyway, so I was talking about previously in the last episode of Dr.D, Dr. DZ, we were talking about the idea that if you are going to a chiro, you're going to go through the exam and blah, blah, blah. And I was going to start talking about what I'm about to talk about now, which is the whole, I like to call it like the skin in the game kind of concept, where if you are going to go to a chiropractor to treat a certain situation, the one thing about chiropractic that's important to realize is that a lot of the magic, if that's what you want to call it, a lot of the vast amount of the benefits of seeing a chiro are not fully established, I might say, or elucidated on or whatever in the first visit. So it's very easy for somebody who's used to maybe a more allopathic way of approaching certain things, where if you go to an MD and then you get treated by them giving you some kind of medication or whatever, it's much, depending on the medication, of course, it's much easier to get a quick, more short-term pain relief kind of, result from it, right? It's easy because if they give you a medication that literally tricks your body into not being able to feel pain, it's very easy for you to forget that you have pain because it's being masked by whatever. And the idea of them doing that is that they're hoping that if they give you that medication, your body's going to be able to heal whatever the problem is by the time that the pain medication wears off or whenever your prescription's up or whatever. That's a good way. And I don't think that's one way to approach it. It's not the way I'd do it. But again, there's nothing wrong with that, and I don't think that they're abusing you or anything like that. So it's not me bashing on the medical model, but that is, I believe, the approach that they like to take, which is give you the medication to essentially allow your body have for a lot of situations. Obviously, with like diabetes and stuff, it's a little different, right? Because you need that, or otherwise you'll pass away, and that may never stop, blah, 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 but that's a whole other discussion. What I will say is that if you're getting this medication to just mask it for your body to heal it on its own, that's one way to do it, but there's always the issue of knowing if it's something that can be healed without some kind of outside assistance, which is usually at their points probably where the surgery starts coming in, or you're going to PT, right? That's usually the approach that they would have. I think it's safe to say that I'm not blowing anybody's mind with that. I'm not like some radical coming out with the wild ideas like that. But the idea is that if you go to a chiropractor, the benefit of seeing it is probably not always apparent on the first visit. My general rule of thumb is if you come to me and you are being seen, I've had some people where, they feel better after an adjustment, but then it tends to work its way back because, when you release them here, they go back to what I call the shark tank of life. The benefit of having something like a care plan is that it puts skin in the game, which is you say, I'm going to commit to coming in here 12, 24 times, whatever it happens to be. And by the end of it, the benefits of what we were doing should be pretty clearly established if you are a good candidate for chiropractic care. Now, is there the idea that maybe if you were to do the payment, maybe you're not a good candidate for it and that you've just wasted all this money or blah, blah, blah? I think depending on the chiropractor or, the kind of business model that they have, I'm sure that can become kind of tricky and difficult. At least in our location here, what we do is we offer you a discount if you do the full buy-in, just because I understand how expensive it can be. And if you do that, you get a little bit of skin in the game, you save a couple bucks. Now, if you decide halfway through it, you're like, this isn't for me, what we would do here, and I don't know if I don't think every chiro would be willing to do this, at least from like a refund standpoint. We would give you back whatever it is that you didn't spend, and we would just essentially remove the discount, because at that point, it would have only been however many visits or blah, blah, blah. You usually get some of your money back, or you usually get the majority of your money back when you do it that way. But what can happen is that there are some chiros out there who might not do that because they have a no refund policy or blah, 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 or whatever. I don't look favorably upon that kind of business model, but that's obviously not up to me. I do think that if a chiro were to do that to you, if you really were to kind of stamp your foot down, you probably could get the money back. They're probably just a little gun shy on, letting go of funds that they've already put into the bank or whatever. There's here we go with the little hat thing. There's the business hat. When it comes to Dr. D's business model. But that is something that you might bump into. And so I think that kind of approach can put a bit of a bad taste in somebody's mouth because they think, look, I forgot to turn that stupid thing on. You have to have a magic rock a magic rock in the background to really tie the room together, you know? Anyway, but yeah, if you are going to do something like a treatment plan, there should, you should know the why, right? So like anytime a doctor recommends anything, the first question I always think to myself from a scientific standpoint is, well, why is it that you want 12 visits or 24 visits or whatever? And if they don't tell you an answer that you find particularly satisfying, I guess, or whatever, one that's not really evidence-based, well, then I think that's a little bit of a red flag, and you might not want to necessarily trust that person with that much money up front. And if they only allow you to be seen with certain rules where it's like, you have to pay me this amount of money for a treatment plan for me to see you at all, then I think, again, that's kind of raises my hackles a little bit. I think if there's an option there, the way I see it is if a care plan should be used as a discount model where you can essentially save a couple bucks and then you also get some skin in the game. But if that's not how they do it, whatever, blah, 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 maybe they're just charging up for it. Like, I don't know. It kind of depends on the chiro. When it comes to looking at it from a more positive aspect, I do think that care plans have a use, and they can get you through, I guess, maybe a little bit of that that doctor-patient trust issue that might come up in the very first time that you meet somebody. And you can save a couple bucks if you just pay it more upfront. Again, that's more of like a personal preference thing. If you don't want to do that, if you come here, I don't care, whatever, because like technically the way I see it is if I offer a discount and you don't take it, technically speaking, I make more, I guess, or whatever, that's what I mean. It's like, I look at it from the viewpoint of like, oh, I'm trying to do them a favor. If they don't want to do it, then that's fine. I sleep well doing it, but not everybody sees that way. And that's okay. So, we just do whatever we can to just, make each other feel comfortable or whatever. As long as everybody gets better, who cares? But it's fine. As long as I keep the lights on, there you go. Big bonus there. So yeah, I think for the most part that answers that question. I think it's been a little while since I answered the before I did the before recording, so I just want to make sure I'm not making a boo-boo here. But yeah, that's something I would think about, is just the why. It ultimately just comes down to the why. Why do we do one thing over another in regards to like doing the treatment plan, or I'm sorry, as far as like the care plan goes. So let's go through some comments.
Hey there, it's me, Dr. D, and I know you're watching this channel and I really appreciate it, and we're having a lot of fun, but something that I have to ask you, can you please like, favorite, and subscribe to this channel? It'd be a really, really helpful thing, and little guys like me, little old chiropractors like me, just trying to make our way in this world here. I keep getting told I'm supposed to tell you guys to do this stuff, so please do. And if you can go to that little bell, I think it's like below us, and you give that a little click, and it says to just remind you when the videos come out, that would just be swell. So thank you very much for watching our videos and making sure that we feel as appreciated as we do, and hey, can't wait to see you in the next one. I'll get back to the video.
This comment goes, they are probably going to try and sell you a paid in full care plan. From my experience of working in an office that treated new patients that way, I have confidence that you will see a cookie cutter care plan north of 20 visits for $2,500. That's not a promise, of course, but just be prepared for the craziest possibility. It's a 3-step process to see how committed you are to fixing your pain. And if you don't come back or decide not to pay in full, then you just want a band-aid and not the fix. I am a bit biased, but it's pretty normal in this profession. Not sure how anyone can create a treatment plan with no exam. Hint, you can't. Yeah, that actually I don't think I've mentioned that. If you go to a doctor, I think in general, I don't even think it's just chiros, they have to do an exam. If they don't do an exam, they're not allowed to touch you, because at that point, the idea is that they wouldn't be able to find something like a red flag, which is potentially dangerous for the person that we'd be treating. So like that's why you can't just go into a chiropractor's office and say, hey, I saw a chiro, when I was 12 and I'm now 33 and I really enjoyed chiro. Can I just lay on the table and get cracked? Technically, no, that is actually not legal. You have to do an exam, even a tiny little exam where you just ask the most basic of history and even just kind of tippy tap it. And as long as you ask some of the red flag questions, that's almost enough. But again, you have to do an exam. You have to do an exam. There is no discussion on it, and you can't convince them otherwise if they're a chiro that enjoys keeping their license, shall we say. But something to think about. You can't go to them and then just say fix me and then they hand you a bill. Like that's just that's not how it works. Yeah, they have to do an exam. Just keep that in mind. And I somewhat agree on this. Yeah, this is clearly, the guy's name has the word chiro in it, which makes me think that he's probably a doc. So I would say that is definitely something I have seen is I guess you could say a cookie cutter. I mean, I'm not entirely sure what a cookie cutter treatment plan is, just because of the way chiro works, where, like an adjustment's an adjustment. It's not necessarily like, you don't like spin it a different way. I don't know if they have like a left hip problem or whatever, but I kind of get what they're going for here, where they say, you should see the 3 times a week, 2 times a week, 1 time a week type of approach. If you're a chiro, then you know what I'm talking about. If you're not, you probably don't know what I'm talking about. But scientifically speaking, they say that when you're in acute pain, 3 times a week is warranted for for what they call like a treat for like for a period of time. They usually measure everything in 4-week periods. So that's why they say you should be, and like in the first month, roughly speaking, you should be getting about 12 treatments. Then it goes down to twice a week for about a month, which is 8 visits. And then it goes down to one a week. That's scientifically speaking, that's what has been established as the best way to treat an actual like full-blown acute injury. That's something like a sciatica. Like they come in and they're just dying in pain and they cannot function. They can't go to work because they're in so much pain, and it's just pain. That's usually the approach you would take for that. The 2 times a week approach is usually warranted for something that's like more subacute, maybe chronic. I could also see maybe a chronic issue being attacked with a 3 times a week type approach. But I think that's kind of what he's hinting at with the whole more cookie cutter approach, where he just says that everybody's a 3-time-a-weeker at the beginning because of whatever, blah, blah, blah. Not necessarily. I don't know if I always agree with that. There's definitely situations where being treated 3 times a week is warranted. I have seen those people. And sometimes you do just need 24 visits. That's just how it works sometimes, There's nothing wrong with that. It just depends on the situation. So that's why I always like to measure things in 2-week periods, where if you go to somebody 3 times a week for 2 weeks and after 6 visits they're like, I don't feel any different or any better whatsoever, I say, okay, let's re-establish what we're doing here. It's not necessarily a re-exam, but it's kind of just like a little check-in that I like to do, where I just ask, like, how you doing? I mean, like, do you feel like you're able to meet your goals better? Like we said, oh yeah, I want to be able to walk again or whatever for a mile or whatever it happens to be for whatever situation. In which case, I think it leaves the cookie cutter approach, because at that point you're aiming it towards their specific goals. So if you say, hey, let's make walking one of your goals, you can't do it, and they can't get the full walking, goal through, you ask, well, why is that? Let's go through a walk, like a walk in the office per se, and I'll take a look at it and just analyze to see if there's something specifically wrong with that type of thing. And I think if you have personalized objectives, it's a lot easier to kind of escape that whole cookie cutter approach. Again, it's kind of like a doc philosophy type thing. It just happens to be my thing. There you go. It's kind of something to think about on that. Yeah, here's another one that kind of made me giggle. This is a huge part of why people don't trust this profession. Chiro for 22 years, and I've seen it all. Yeah, there's just some scumminess to it. The whole huge care plan thing that isn't really medically warranted, I think, in some ways. Again, I don't think everybody does it out of a sense of maliciousness, but I can definitely see why that would shake people a little bit. Where, again, if they don't explain it, especially, that's the tough part. Like if you can explain it and be like, listen, this is kind of what's happening. It's like, the first 3 weeks, we are decreasing pain. Or first 4 weeks, excuse me. First 4 weeks, we're going to decrease pain. It's all about, we're going to be pain focused. Get you out of pain. Pain is bad. If you're in that kind of pain, then if it takes an entire month for you to really get lower, then, that's something that you're really going to find quite interesting, where you just don't want to be in pain anymore because you cannot function. I think that's warranted. So even if your care plan just, was done in the different phases, where you're like, hey, if you come in for these, 12 visits or whatever, I'll give you a discount, but whatever they happen to be, whatever. You have to understand the phases of care, where at the very beginning, it can just be pain focused. But what if you come in and you don't have pain? Right? There's a lot of people that get chiropractic treatments, but they're not necessarily in pain per se. Well, what do you do then? Well, that's where you start wandering into the 2 times a week at the very beginning thing, because you say, listen, you don't have pain, but you're looking to try and increase your lifts. You want to increase your squat weight. But when you try to go down, your ankle doesn't have very good mobility. And because of that, you're not able to, get as much weight on the bar that you want, to go as low as you want, because you physically just can't get that low. The word pain never came out of my mouth. So when you're looking at it from that point of view, you're looking from like a functional standpoint, you might be asking, well, why would I want to come twice a week when I'm not necessarily in pain? Well, there is a certain level of altering the nervous system that comes with the being adjusted part of it. So we can move the ankle back into place. That's pretty easy. It's not really all that difficult to move a joint into a position that you really want it to. The problem is that you have established neurological movements that you have based your entire movement pattern. You're going to be walking differently because of the way your ankle is, because it doesn't feel good. And because of that, your entire body is going to be moving in a certain direction, because there's like a certain kind of like flow that goes up, where because your right ankle's always been a little stuck, your left ankle maybe takes a little bit more of the weight whenever you take a step or whatever. So whenever you get seen twice a week, what you're doing is you keep pushing it back into its original place, so that your body can essentially relearn that whole mechanism. The more flawed, I guess, or whatever, the more compensatory. I don't know what the adjective, I don't know what the form of that word is. Anyway, but it's a lot easier to do that when the body is being pushed back into the place that it's supposed to be, and being adjusted helps in kind of inspire it, excites the nervous system so that it learns a new process wherever it is that you're being pushed on. Right. That's why a lot of people feel like they can breathe better after they get a thoracic adjustment, because as they get pushed on, it opens up the chest cavity while also essentially inspiring the nerves that go to the lungs. And when you do that, you're able to breathe better because your nervous system is essentially working a little better. When you look at it from that point of view, that's why not necessarily when you go to a chiro and they ask you for a plan, you're like, I'm not in pain. Why do I need a plan? Well, now all of a sudden, if you have skin in the game, you're more interested in having the ability to last for 8 visits before you're like, okay, I got 1 visit and I noticed my breathing didn't improve or whatever. Because sometimes those things take a little bit of time just based on the hurdles that we have to overcome. It's the whole peeling the onion method. We start adjusting your neck or whatever. And then when your neck becomes looser, whatever dural tension, so the dura, I'll probably put a picture of it up here, is the sheath that surrounds your nervous system, your brain, and your spinal cord. Essentially, it's essentially like a big bag that holds it still and keeps the fluid in where it's supposed to be. And that dura attaches to the bones essentially. And when those bones start to twist and torque, it creates a tension on that sheath, which means that other parts of the body have to essentially spin the opposite direction, and they may not move as well if what I call the prime problem, let's just say it's the neck because you slouch or whatever it happens to be. When you handle that, all of a sudden, all the way going down, it's going to start to loosen up, at which point when you do an adjustment in those areas, they should move a lot better, but that might take some time because the body is very interested in keeping the nervous system alive, because when you really boil down what it is that we are essentially just a nervous system when you boil it down. So the body's very interested in maintaining stability when it comes to where the brain and the spinal cord is. So when that happens, you have to think, okay, well, if that part of the body doesn't want to move, we'll move the parts that can. The rest of it should slowly unwind. And then all of a sudden, when you start doing treatments in other areas, they start to become a lot more effective. And maybe it's not even the area that you were coming in to complain about. A really good example, whenever you do like a cling or whenever you want to do like an overhead type movement, you might think, oh, it's got to be my shoulders out of the problem. But then there's something called the latissimus dorsi, which is the muscle down there in the back that actually, funnily enough, attaches to your pelvis, that comes all the way up and it attaches to the front, I guess, of your shoulder or arm, if that's what you want to call it. And that is essentially a swimmer's muscle because it helps you do this movement. Now, if that muscle's super tight, if you try to do the opposite movement, you're not going to be able to go as far because it's going to be restricted in that plane of movement. And then you're not going to be able to bring it up and do like a cling or whatever it happens to be, like a military press, whatever you want to call it. Again, has nothing to do with pain. It could lead to pain. Just because if that muscle's especially tight and you try to do a lot of upper body movement, it can cause low back pain by causing your low back to try and compensate by moving forward. And that's exactly what we're saying when it comes to trying to get, again, your skin in the game, because you can't just fix all that in one visit. It would be very difficult and it would require a lot of faith in the higher powers that be, that just getting that stuff stretched out and treated once is going to fix it. No, it does take time, and it's unfortunate. If I could fix everybody's problem in one visit, I would love to be that kind of person, but unfortunately, I don't think anybody's that kind of person. But there you go. That's why PT is the same way. You go to a PT, you go to a physical therapist, they can't do everything in one visit. They have to strengthen certain areas, and that just takes time. That's just life. That's just the way it goes. If a chiro can't explain it like that, then I think we have a problem. I think that's where the distrust comes from, because it seems kind of shady, in my opinion. Okay, and here's another good one. So I worked in an office where we very, very rarely adjusted day one. Initial day was orthos, neuros, and x-rays. We would then tell you that we needed time to evaluate the exams and imaging and have you come back the following day. Always would encourage patients to bring their spouse, everything that others have been saying when it comes to trying and sell you a full paid care plan. Yep. I can understand clinically why a practitioner would want time to go over the x-rays. It makes for a more informed and specific adjustment, but I always had a hard time trying to sell the patient on care. I am from a chiropractic background, which is what led me to become a chiropractor. So I firmly believe that it is a wonderful thing if used properly and objectively, but I feel like if patients don't want to commit to months of care and thousands of dollars up front to receive help, then our care is not for everyone. At that point, it is more of a luxury than healthcare. So if they do try and sell you a plan, do not disregard chiropractic as a profession. You will just have to find a chiropractor who's willing to listen to you, work with you, and ultimately help you. Yeah, that's essentially what I'm trying to say. Because when you think about the cost of it, not everybody can afford like multiple thousands of dollars for a care plan, right? Some of them just have to kind of play it by ear. And, there's advantages to the barter system. Like some chiros can barter. I mean, if it's really that bad, there's definitely some advantages of being a doctor running your own place, because technically speaking, it's like, I could charge you kind of whatever I want. I could say, hey, if you give me your finest cow, I'll adjust you 12 times or whatever it happens to be. Like, what is the market value of a cow? I have no idea. Off the top of my head, I couldn't tell you how much, couldn't tell me how much a milking cow would cost these days. But, you figure when you look at it from the viewpoint of luxury as opposed to healthcare, yeah, there's definitely a little bit of that where chiropractic is beneficial to everybody, and so it should be made available to literally everybody. It can get very expensive just because of the fact that, you know, you have a trained person who spent a lot of time going to school to learn very specific things for them to work on it, you know, and they have to charge money to keep the doors open. Like, you know, that's just how commerce works. Are they trying to make it to, you know, afford a yacht or blah, 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 or whatever? I don't know a lot of chiros with yachts. Let's just put it that way. I can't think of any off the top of my head who have some extravagant lifestyle. So even I think in the worst cases, you know, they're just trying to, like, you know, pay the bills, pay their employees, and, you know, make some decent money so that they can afford toothpaste or what, you know, whatever it happens to be. Like, I don't think a lot of it's being done maliciously. I do think that, you know, the chiros that are doing the care plan for the right reasons, I think are doing it for the right reason. But there's definitely a lot of chiros out there who have kind of gone to the business side, maybe a little bit more than the treatment side. And I think when you do that, you lose track of kind of who you are in some ways when you go to school. Let's just say when I went to school, my first thought wasn't, oh boy, I can't wait to look at spreadsheets and analyze the benefits of this particular marketing strategy over another or whatever. It can be kind of exciting, don't get me wrong, but ultimately speaking, when I come into this office, I want to treat people. That's what I want to do. I'm all about it. I love treating people. And if somebody comes in with a stiff shoulder, I'm like, man, I am glad I woke up today because I can't wait to help this guy do whatever the heck it is he wants to do. That's just how it is, baby. But I do think that there's definitely some things that are consistently happening in certain clinics that they just have a bit of a weird feeling to them. They have a bit of a stink that I think a lot of people do smell. Whether it's malicious or not, I don't necessarily think it's malicious. But I do think that it is something that you see enough where it's not a coincidence, you know, and here's a bit of a positive spin to that. So in relation to that question, or the comment that was up just above, so somebody says, disappointing because he had nothing but 5-star reviews on Google with over 80 reviews. Then one of the reply is, maybe those people like his care. You don't get 5-star reviews if you're crap. Yeah, exactly. That's kind of what I'm getting at here is the care plan has a purpose. It has a purpose where you can't shortchange your own treatment. And that is the benefit of the care plan. Like, I get, you know, it's a lot of money up front, whatever. The way I look at it is if you were going to be fully into this and you're going to go from beginning to end, soup to nuts, you go from boom, 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 you go through the whole thing, you would have paid that money anyway. Now, does it make sense to fully pay it up front? Maybe you don't have like enough, like, you know, liquid capital to just pay for something like that up front. Like, understandable. That is definitely something that can be a factor for sure. And maybe that doctor offers you like a treatment, you know, payment plan or whatever. You could pay like however much every month or whatever, blah, blah, blah. That's a different kind of approach to it, right? But when you look at it from this viewpoint, this person has a lot of really good reviews, whoever it happens to be, probably because they're a good chiro. And if you go to this person and they help take care of your issues, and then they, you know, have a care plan that is actually personalized to your specific type of care, and then you walk away from it and you're like, at the beginning I was a little skeptical, but then I walked away after, you know, a month and I was like, you know what, dang, I do feel a lot better. Well, there you go. That right there just explains to you the purpose of the care plan in its perfect form, right? You know, when it's not being used kind of cookie cutterly, I guess. I'm not sure if that's a word. Cookie cutterly, as was kind of stated before. Like I said, it's not all bad. If you go to a doc and they instantly offer you a care plan, I don't think it's like grounds to be like, oh, this guy's trying to take advantage of me and I should run for my life or blah, blah, blah. There are good chiros out there that do it for the right reasons. And I think if you like the chiro and they explain to you in a way that you find satisfactory for whatever it happens to be that your problem is, well, then I think you got a winner. There you go. Become their best friend. And this one is, honestly, the adjustments would be the least concerning part for me. If they haven't even examined you properly, how are they deciding you need x-rays or decompression? Yeah, that's a good, yeah, I agree. If they haven't even like asked you what's wrong, you're like, okay, here you go. You should buy this thing. And they're like, do you want me to tell you what's wrong? No, I already know. It's like you should at least be doing like the most rudimentary exam. And that's exactly why you can't just walk into a chiro and be like, crunch me, do it. You won't. Will you a chicken? It's like, yes. Yeah, actually I am. I am actually very risk adverse. Please don't take my license from me. I paid so much money for that thing. Yeah, so that's that's a really good point. You should be thinking about it from the point of view is like, I can't wait to be examined so that they can actually figure out what's wrong with me. Okay, and these will be the last two. One is a response to this first one. So the first one is, I think the expectation should be to not receive treatment on day one. Some chiros do treat on day one, but not all. Most professions don't do treatment day one. If you went to the dentist and had a cavity, you would need to schedule another visit for that. Usually, I would do an exam, and if I thought they were necessary, x-rays on day one. Yeah, I agree. I think getting an exam and not getting an x-ray on the first visit is kind of... So it's a little unenjoyable, but I guess, you know, there could be like time issues with that where you'd have to come back just to get the x-ray, blah, blah, blah. The exception is if a person doesn't know if they even want an exam, we will schedule a day one visit as a consult only. If it is scheduled as a consult only, I don't always have time for an exam afterwards, and a patient will need to come back. The consult thing is an interesting way to look at it, where, they come in and they ask you some questions where they're like, hey, I have this pain, blah, blah, blah. Technically, a consultation, you're not really because as soon as you start to touch them, where you're like, hey, let's move your neck and like this way or blah, 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 whatever, that turns into an exam, and that's where it kind of gets a little weird. If somebody just comes in and they have just questions about like what chiro is, you can consult them and be like, hey, listen, a lot of people have neck pain. They come through here. A lot of times it's because of degeneration in your facet joints in your neck and blah, 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 or whatever it happens to be that they want answers to. That's what essentially a consult's for. It doesn't replace the exam. The exam is a separate thing, right? Just keep that in mind. And then one of my favorite replies I've seen in a while, bullocks. Must be British. You're in pain, and when you go to a professional, you should expect some sort of treatment. Okay, I understand that some chiropractors don't want to adjust without x-rays. That's up to them. And if you don't try to treat you when you're on pain, they're just being a jerk. There aren't enough red flags on the planet for me to not at least try to help somebody on day one. I would say that there are plenty of red flags that exist that would most assuredly prevent me from treating somebody on day one, such as the DVT or like an embolism of some kind, where they're like, I can't breathe and my chest really hurts and it feels like there's an elephant on my chest. I'm like, not treating you. Out the door you go. Let's go. I'll call you an ambulance. Let's go, buddy. You got places to be that aren't here. When you look at it like that, there's definitely some red flags that I'm like, I'm not going to treat you, buddy. If it's a life-threatening thing, I don't think they have time for chiro. I think they have time for living, like in a hospital. When you go to a chiropractor and expect an adjustment on the first visit, I think in some ways you will be disappointed. I do tend to agree that the people pleaser empath in me has a lot of difficulty trying to turn somebody away where they come to me and they're like, please, I am in pain. Please help me with my pain. It's very difficult for me to be like, nope, bye. There might be something like a time restraint. And I do think that some of the gravitas of the medical system, I do agree, where, it's kind of like a dentist, right? Where, you don't go to a dentist and say, hey, doc, my tooth hurts. Rip it out. You're just like, will you rip that out for me? And they don't even look at it, If, the first time you go to a dentist and you're like, my teeth hurt, they might be like, okay, well, let's look at your teeth. They look at it and they're like, oh, wow, that's a tooth right there. That's a problem. They're probably not going to have enough time to do a full, dental situation. But the difference is like to go through an actual dental surgery, that's a lot of time, Like an actual chiropractic adjustment, if done effectively and with some expediency, it doesn't take that long. You could finish a full chiropractic treatment in 7 to 10 minutes, just being honest here. So it's like, I kind of get both sides of that argument. And I do think that there is something to be said if you go to a chiropractor and you get an x-ray, if they're like, come back after I've looked at the x-ray, I completely understand that, because they're thinking, oh, I don't want to push on a bone that's compromised, or there might be something growing there that might not actually be there. Where are we going to adjust? Should I be mushing on C2 if there's a lot of degeneration in that area? Maybe not. Maybe we only do traction in that area because I feel like something's going to go wrong. But there's a lot of things you could definitely make an argument for the lack of first visit adjustment when it comes to doing something like diagnostic imaging. Other than that, maybe they just do a really thorough exam and they take a really long time going through your history and blah, blah, blah. And they just are scheduled in a way where they just don't have time to give you the crunch. Maybe they tell you to come back later that day. Maybe you don't have time. There's plenty of patients that come in and they say, listen, I only got 30 minutes. Can we do this entire hour, the hour schedule exam? And can you also treat me in less than the amount of time that you would have for the exam? In which case, I'd say you might want to come back. That's my personal opinion. Well, there you go. That's a lot of my personal opinion. That is a bit of the part of chiro that I think makes people uncomfortable with the whole business aspect of it, where, the care plan thing is something that does come up when people say, oh yeah, chiropractors are charlatans and the quacks and blah, blah. I do think that there is something to be said that certain things tend to come up where it may not necessarily be like a personal preference for their treatment style. Like, it's one thing to say on a website, oh yeah, chiros are charlatans because they move your bones around and then it makes your headache go away or whatever. That doesn't make sense. Well, yeah, it may not make sense to you because you don't know how it works. That's like an actual scientific thing. Those kind of people, you're like, okay, I don't have time to talk to you. You're lost. You don't want, you're choosing to not understand or even listen to the explanation for why it is that's happening, and that's fine. You don't need to be treated that way. You can go do whatever you want to do, whatever you do believe in. But when you look at the salesmanship type thing when it comes to the chiropractic business aspect of it, here's the hat again. when you look at it from that point of view, well, then I think that there is something to be said about you have to explain why it is that you're doing things. And some people can't do that very well, or they don't want to. And in which case, then you shouldn't be offering that kind of thing, because it's putting a lot of bad tastes in people's mouths for people who are trying to do things for the right reason. And I think that's not only a chiropractic thing, that probably applies to a whole lot of other things when it comes to going through this world as we know it, right? But yeah, it's kind of a bit of a, I don't want to say controversial take, but it's definitely something that is heated in the world of chiropractic, understanding, like acceptance, I guess. I'm actually kind of curious to know what you guys think about that down in the comments below. I do read all the comments. I try, man, I do try. YouTube makes it hard sometimes, but I do try to read all the comments. So if you do make a comment about it, I probably will read it. I am kind of curious to know what your thoughts are. I like care plans. I'm a chiro, but I find a lot of value in chiro. So I think that if you are really gonna, again, put your skin in the game, and you are worried about your spinal hygiene in regards to just making sure all of your spine joints are moving as well as possible throughout the week, even with the absence of pain, well, then I think a care plan or some kind of subscription-y type model, I think is absolutely warranted. They do that with other businesses that people don't seem to have problems with, which is like massage therapy, or even like magazines and all, like you read a Reader's Digest where you're like, I want to exercise my brain every month, but nobody will raise an eyebrow on that one, where they're just like, well, why is it that I'm spending $15 a month on this like magazine, blah blah blah. And I get that the money values are different and all that, and the content of it is much more, I guess, a little bit more like ethereal, or maybe not ethereal, but it's a little bit less like concrete. Like when you pay for a magazine subscription, you have a magazine, but when you get adjusted, it's just like, I feel good, I feel better. But then somebody says that you look fat in that shirt, and then you feel like poop. Well, is that the chiros? Like, you know what I mean? It's kind of like there's a lot more factors that go into a human being's well-being than an actual like concrete object like a magazine. And I think that adds a whole layer of kind of funk to this thing. As soon as you start including things that aren't purely logic, it's a lot harder to stay mindful. That's just being a human. Welcome to the condition. And make sure you grab your towel and enjoy your stay. I guess is a good way to put it. But yeah, thank you very much if you've gotten all the way through this one. I hope you found this one kind of interesting. It's a little bit, I don't want to say it's philosophical per se, but it's definitely something to think about. It's definitely a thinker. And I think that everybody on all sides of the discussion are probably right, because I think a lot of it just comes down to personal preference. But I do think that if anybody says that a treatment plan is in itself inherently evil, I don't agree. I don't think a treatment plan is evil. I don't think it's wrong, but I do think it has to be used responsibly and for the right reasons. And I'm going to leave it at that. So I love you guys. Thank you very much for listening. If you can, just be a dear, go down there and pop the subscription button and the I found out that favoriting, it doesn't exist anymore. That's how long I've been using YouTube. I completely forgot that favoriting isn't a thing anymore. But yeah, it's like, if you could like and hit the bell and all that kind of neat stuff to help people watch this kind of stuff, then I would absolutely love you for it. I really appreciate it. So again, I love you from the bottom of my heart. This is Dr. D. I'm on my way out. I'll catch you next week. Keep it popping, guys.